Hello, Dr. Dimitrov. Nice to see you again. I appreciate you taking the time to talk to me today.
Sure, I'm in between cases, so you've got about 5 minutes max.
Got it. I'll get started then. Last time it was our first meeting and we spoke about your practice, future developments and your experience with Advate. Today I thought perhaps we could talk a bit more about your clinical decision making around treatment choice. Would that be okay with you?
Yep, sounds good.
Great. So let me start by asking you about how you treat your pups. What are some of the factors you consider?
I prefer to use the latest third generation products, but to a certain extent the tender dictates what I can use.
So despite the tender guidelines, you have kept some patients on Advate. What were the benefits around using Advate that made you opt for that choice?
We're able to keep them on the drugs longer, the younger patients.
Were there any other factors for keeping them on Advate?
Not really.
How about services such as patient support?
Yes, my nurse may have a preference for patient support.
Yes, I spoke with her about it during our last visit and indeed it was important to her. Doctor, since I know you only have a few more minutes, can I ask you if you have any new pups on your radar?
I do actually. A young boy, about 3 months old now. He'll be needing a surgical procedure in about 6 weeks, so we'll be putting him on treatment.
Okay, well, with that particular patient in mind, what is going to be the most important factor for you when you make your treatment choice?
I think the thing with this patient is the mother. She seems quite stressed around treatment for haemophilia, and with regular prophylaxis, which will come with a severe patient, I think that she's going to find it quite hard because she's on her own.
I see. So it's more about the family dynamics. Okay. Any other challenges around that patient coming through? Or rather, what clinical decisions will you be making around choosing a factor 8 for that family?
Because it's a new patient and the parent is quite nervous, having data on hand to share with her can really make a difference. And there isn't much differentiation between the products at the moment. So again, third generation is important.
You mentioned third generation, obviously recombinant and are experienced with its use. Do you rely on your clinical experience or clinical trials or a bit of both?
Well, a bit of both, and it depends on the patient. Most of my experience pre-tender was with Advate.
I do want to share some clinical data with you. First, anything you get particularly challenged with that we could support you with?
Nothing specifically.
Okay, and you mentioned a surgical procedure. Have you had much experience in the past with use of Advate for surgical procedures?
Yes, quite a bit.
How has it been?
Good. Yeah, very good.
Right. So then, Doctor, I just have a few bits to share with you about Advate in surgical procedures and also Advate in terms of use with pups. Some clinical data to help back up your clinical experience. Doctor, as you know, we're quite committed to providing you with post-marketing studies on pups, giving you support on efficacy and also safety profile, which is important for pups normally. So perhaps I will show you some data.
Okay.
Let me locate data for you here. Data should be in here. Let me show you pup data here. It was a prospective, global, multi-centre open-label study. Basically, used with pups, there were 55 patients in total and 44 completed the study. And most of the adverse effect was inhibitors self, as you would expect with exposure days. Basically, data shows with Advate it's a normal range of 29%.
I had an issue recently, so that's reassuring to know.
An issue with an inhibitor?
It wasn't an Advate patient.
Inhibitors can happen. It's a well-known problem. Reassuring, this study was with patients that you are likely to see.
Is this the most recent data? Is there similar information on other products?
Well, there isn't a great deal of experience as yet. We are lucky to have some data on pups. The competitors will get data eventually. What that looks like we don't know, but our data is currently available. Published in abstract form with the full study coming, best data you can get to date.
Interesting.
So Doctor, with your young patient in mind, will you consider using Advate on him?
It's interesting to have the paper and to be able to share the recent data with the commissioners and also reassuring the mother. Yeah, it looks good.
Is it your choice or do you put a case forward on an individual basis?
I put the case forward, but look, we're running out of time, so I really have to wrap this up.
Sure, just a few more points. What criteria are commissioners using for approving use of Advate on pups?
It needs to be something different about the product, specific benefits to the patient.
Were you aware that Advate's latest development is the 2 millilitre volume? It's a similar reconstitution and the same device for ease of use.
I didn't know that.
Do you think the 2 millilitre volume could offer benefits for your patient?
Well, it's quicker to give, I suppose. When's it available?
In the next month. Would the 2 millilitre demonstrate a benefit for commissioners?
Additive to the package?
Will the 2 millilitre volume and clinical data be enough to show commissioners?
They'll still likely say that when there's an inhibitor, it's more expensive, but it helps.
Well, with that context, will you consider taking Advate to commissioners for this patient?
I'll give it a go at the next meeting.
So, Info-1 inhibitor rate, 2 millilitre volume and perhaps a case study?
That sounds useful, but we really have to wrap this up. We can't get to the case study now.
I really appreciate your time, Dr. Dimitrov. I will get you the materials shortly.
Thank you.
Thank you.